Julie leads the multidisciplinary team meeting, which regularly meets on a monthly basis. She's brought real value to the integration programme. She's brought together a range of professions, all to work together to benefit outcomes for patients.
It's very much a very good forum to bring case studies for us to explore how we're managing them and who's working very closely together with these patients. So it's actually allowing everybody to put a piece of the jigsaw together so we actually get a really good picture of what's going on. Myself and the other community matron come into the care homes every week.
Riverview is a specialist unit that particularly caters for dementia. Well, she's very efficient, but she's good fun. She has an absolutely brilliant sense of humour. She can see the funny sides of many things, but she's very empathetic to this client group, very forward-thinking in the ways of managing this client group.
I don't know how she fits it all in. She's really easy to get on with, she's jovial, she's got a great sense of humour. She's just approachable. She's a real team member. She's well liked by her patients and they know that they can rely on her as well.
She's a real motivator. She has great drive, a great sense of fun, and she brings that to the multidisciplinary team meeting, which makes people enjoy the process and want to come and do, you know, real good work, real good integrated work.
She has implemented a whole new strategy of multidisciplinary team working, the efficiency with which the system works, the lines of communications are far more open. I think she's absolutely brilliant at her job, I do.
I was really shocked to be nominated because I didn't expect anything like this, and also it was something I was challenged to do that I haven't done on my own. I've done as part of a team that all have developed really well, good relationships working together. So it's not just about myself, it's about the input everybody's put in really. But yeah, I was shocked and a bit embarrassed.
District Community Mental Health Service is an integrated community mental health team based in 2 sites. It's managed by Bradford District Care Trust and by Bradford Council Local Authority, and it's a mixture of health and social care staff working together.
Been a number of transformational changes within the team, one being the development of a continuous care model where the consultant psychiatrist, the care coordinators and the clinicians are following service users through the pathways within the community, the acute services and within primary care. I've been extremely impressed with the hard work, how they've worked together to deliver these transformational changes.
The continuing care model is really important for the council as well as for the NHS, because it means that as people come in and out of acute care, they get the same level of service.
Since the introduction of continuing care model, all the consultants are based in the community, following their patients from inpatient to outpatient and vice versa.
The District Community Mental Health team have been through a lot of changes over the last year. They've embraced all those changes with enthusiasm, they've worked really hard, they've been really positive, and they've remained focused on the needs of service users.
The best thing is patient care and safety and working together to manage these changes.
If the team won the award, I'd be absolutely delighted. They've worked hard, they need recognising, they've pulled together, and by working together, this is what you can achieve, and that is a building block for the future.
Firm ward is an acute inpatient unit for people, for gentlemen who are in a crisis in their life and in distress, and that need quite intense support throughout that period.
I nominated Firm Ward because I feel very proud to be working in such a great team. We've got a lot of very experienced nurses on the ward, and we've also got quite a lot of new starters, support workers and staff nurses. We all seem to have worked exceptionally well together to try and achieve excellent results. and improve standards on the ward.
As a newly qualified nurse, I noticed straight away how well supported everybody were, especially as a new starter.
In our nomination, I put forward some poems that one of the service users had completed on the ward. I thought it was really quite a special thing to do. It sort of came from his heart to describe how he felt on the ward and what benefit he got from the ward. This wasn't done in sort of any creative writing group, it was just purely from his heart, and it's helped him in his recovery.
We've just been making an orange cake. Andrew's made an orange cake. We usually try to organise this every couple of weeks so they have something different to have for their supper. We've got a new member of staff who started and he's very much into sports and everything, so he organises a lot of pool tournaments and badminton tournaments which have gone down a treat with a lot of the guys, and it's just getting on there doing something quite activity-wise, especially if you've been on the ward for a while and you've not managed to get out and about. That's been really good. That's gone down a treat.
I think Fern Ward's special in the way that management of the ward and the hospital itself and more experienced members of staff really encourage others to get involved in what the ward's about and what the ward's doing.
I've seen quite a lot of changes on the ward over several years, and I think at the moment the team is absolutely thriving and working really, really well together.